Hello everybody, it's me Wendy. How are you? In case you're just dropping in for the first time, I was diagnosed with invasive ductal carcinoma stage 3 breast cancer on April Fool's Day of 2024. So I've been going through chemotherapy and I'm on the TCHP regimen. I am getting ready to do my final treatment next week. So it's been a while since I did a video. The last time that I dropped anything was right after my 4th round. And that one kicked my butt really bad. So it just hit me really hard. And my stomach was in a lot of turmoil, so I threw up for the first time ever on chemo. It was pretty horrible. Then after that, I had to go into the hospital to be hydrated because I had really just got very dehydrated. Anyways, after that, everything went really smoothly. Then I went in for my 5th round 3 weeks later, and the doctor talked to me about reducing the amount of chemo. So I think they reduced it by between 15 and 20%. She was more concerned with the numbing of my fingers and toes and the cramping. So she wanted to make sure that the neuropathy issues that I was having wasn't going to become permanent due to the chemo damage. So because of that, everything else went a lot smoother. The nausea was reduced, the diarrhea was reduced, my numbness, I do have a little bit of numbness in my fingers and toes, but fortunately I would say it's about like a 20% numbness instead of the 60 or 70% that I was experiencing after the 4th treatment. So this is a 6-round regimen, so this will be my last one. I'm really excited about it because I know that there's light at the end of the tunnel. It's going to be done. But on the other hand, you know, I was talking about how I wasn't really overwhelming myself with all the other steps that I need to go through, and that involves surgery and then radiation. So I was putting that off, but now that I'm at the end of this part, I'm worrying about the surgery. I'm really hoping that after my MRI that they have scheduled in September, I'm really hoping that, well, 2 things. One is that the chemotherapy has been successful. I know that where the lump was, I know that that is better. But cancer is a tricky thing, you know, it can go wherever it wants to go, and you know, it could go into my lymph nodes or through the blood and go anywhere else. So just because I see results on my breast doesn't necessarily mean that it's gone. I think that's my big worry, is I think I'm over worrying things now. I just want this to be gone, you know what I'm saying? And that's one. And the second is, I'm really hoping that my doctor's going to tell me that everything looks great and that we can go with a lumpectomy, because I don't want to lose my breasts if I don't have to. I think, you know, I'm probably going to be like worried about this whole thing for a long, long time. is it back or whatever. But now I'm starting to worry about everything else, and I don't want to lose my breasts. So that's what I'm dealing with right now. My eating has been really, really good, because the side effects from the reduced dosage of my chemo, really everything tastes a lot better. I still have that funky taste that I was discussing, but the flavors are still coming through, which it's really great to be able to eat whatever I want, and I've had pizza and pastas, and I hadn't been able to eat those for a long time because the tomato sauce was too acidic and would just burn. It would burn my mouth, it burned my throat, it burned my stomach. I mean, just everything. You can't even imagine. It would be like eating a really hot, fiery sauce. That's what it was similar to for me. It was very painful. So that was really nice that, I could eat that. Some other things that I've had are just, chili. I didn't overwhelm it with chili powder or anything like that, but I did add some, and then I put a little brown sugar in my recipes, and it didn't bother me one bit. So that was really good. And I had cornbread and just normal foods. Asian food, I had Panda Express. That was really good too. And all these things were, I couldn't eat before. So I'm really happy about that. I went in for hydration yesterday, and I'm up to 121 pounds. And I started somewhere between 110 and 112 pounds. I kind of fluctuated back and forth in the beginning. So as I was talking about previously, before I started chemo, there was a real big concern that I would lose even more weight, because that generally seems to be the case with people undergoing chemo, because everything tastes bad, or you're having a lot of nausea and whatnot. People aren't eating, so therefore they're losing a lot of weight. And I didn't have that problem. So part of me wonders if I was so underweight because of the cancer. Each time I go in and they weigh me, they're just stunned that I'm gaining weight instead of losing weight. They always ask me, what did you eat? What have you been eating? And, pretty much I was living on Carnation instant breakfast drinks and scrambled eggs and steakums, chicken noodle soup, crackers, things that were very bland, applesauce. Cottage cheese was kind of weird for me. It was kind of just tasted really sour, but I'd try and eat some of that. I tried some of that yesterday, and it was still really super sour. So I kind of just ate like a half a bowl, but I'm gaining weight. So I really think the Carnation instant breakfast drinks had a lot to do with it, because no matter what, if I couldn't get solid food in, I was still getting all that nutrition and protein. And I think the fat from the milk also really helped. I feel really sorry for people who are lactose intolerant, because I couldn't imagine being without my dairy. Anyways, I'm hanging in there. I'm hanging in there. I'm going through a lot of other things right now. My daughter passed away last year, and we're coming up on that date. So I've been dealing with a lot of depression, and I just feel so crappy right now on top of it. And I would really like to, plan something like a memorial for her. but it's right around my chemo treatment time, and I'm going to be really sick again, and I know that. So I feel like, I don't know, I feel like I failed somehow in doing all the things that I wanted to do. So I'm kind of going through a lot of self-pity, and I have to work through that. I think that really has a lot to do with why I haven't posted any videos recently. It's just she's been on my mind a lot over the past, well, she's always on my mind, but just with this upcoming 1-year anniversary of her passing, I just been feeling very antisocial, and just been feeling a lot of different things that just, I don't know, I just don't really want to I don't want to use you guys as my my therapy session, but I'm just going through a lot, and I think that I just didn't want to be social. I didn't want to talk to anybody, so that's why I didn't leave any videos. So after surgery, it's going to be radiation therapy, and I had this thing happen. I'm still in pain management for my spine fusion. Been dealing with pain management for like 8 or 9 years, so it's sort of like a rest of my life kind of thing, I guess. I don't know. I was hoping that after my spine fusion surgery that I wouldn't be in pain all the time anymore, but that's not the case. I'm still in a lot of pain, and it could be because of the chemotherapy. I've noticed that for the week after chemo, my bones hurt really bad, and I think it affects my spine a lot more because of the recent surgery. I've got pins and rods in there and screws and fusing material in there, so I think that really the chemo is targeting that area the most. So I'm still in pain management, but I was assigned a new nurse this time because, well, I don't know, for whatever reason, but she had worked with chemo patients in her past, so she was very familiar with what I was going through, and I was really relieved about that because one of the things that they were talking about was reducing my pain meds prior to this appointment. But when I spoke to her, you know, she really sympathized with what I was going through and understood it, that she felt that it was not a good idea to, you know, reduce my medication at this time. But when she asked me about my program and I said that I was getting ready to finish up with chemo and then surgery and then radiation, she kind of just was like, oh, radiation, oh my gosh, you know, that's really rough and blah, 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 your breast's gonna get burnt from the inside out. And it's like, why? I sat there in shock, you know, because I was thinking that it was gonna be easier than chemotherapy. But the way she acted about it was really frightening to me, which was probably the worst thing she could have done, because I'm one of those people that I don't want to know, you know, what it's going to be like. I'm an ignorance is bliss kind of person. I want to go in. I don't read the internet on stuff anymore, like to my condition. I do a lot of research for other things, but I had to cut myself off from Googling everything about chemo and breast cancer and stuff, because what it was doing was it was scaring the heck out of me, right? And I don't need that, because, you know, I'm already battling a disease. I don't need to be battling my own mind and battling my own fears, you know. I also joined a lot of social media groups of other women who are going through chemotherapy. And it really, it was not helpful to me. It was not, because anything that could go wrong would be posted in the group. So then it made me worry. You know, somebody said, for example, I was diagnosed with IDC, which is invasive ductal carcinoma, and I had a PET scan, and because my back was hurting, and it turns out I have cancer in my spine. So I read this post, and then of course I look at myself and go, gee, my spine really hurts. But you know, I just had spine surgery. But because they had cancer in their spine, all of a sudden in my head, I'm thinking, oh my gosh, I've got cancer in my spine. That's it, I'm gonna die. This is it, my life is over. So yeah, that's how my brain works. So I found just that I had to cut myself off from those groups as well, because it wasn't just that instance, it was every single time that somebody had another thing pop up that was more than just breast cancer. I, of course, played hypochondriac and thought, oh God, that's gonna be me, you'll see. So I cut myself off from that. And I think that overall, I think it was probably the best choice I could have made. There was another time, I got this really cool gift basket from an organization that gives baskets to women with breast cancer. And I'm not gonna say who they are, because I don't think that it would be fair to say something negative about someone, you know, who's doing good things. And I'm not going to say that it's a negative. Okay, it was a beautiful basket, and I cried, and I loved everything that I got. But there was a book that was included with it, and it was a story about a woman who had gone through breast cancer. And I loved a lot of what she had to say about advice and her experiences, but inevitably she had some really bad outcomes, you know, bad turns that, you know, she wasn't expecting, and so she did not survive. Because of that, it set my brain in a whole different place, where I was terrified of everything. Cancer is so hard. The process of chemo is so hard. You know, just waking up every day, getting out of bed is a real challenge. It's very hard. That adding that worry and that stress over, is all of this effort that I'm putting in, is this gonna pay off for me, or is my outcome gonna be just as tragic as hers? So it did not affect me in a good way, and I really regret that I read it so early on in my diagnosis. I wish I had read it after I'm done. So yeah, that's it. Just always just really bad for me to be a part of all these groups and read these stories and stuff. I want to be ignorant. Ignorance is bliss, you know, just take it one step at a time, get through one, then go to the next and the next, and pray and hope and cross your fingers and do all those things that you need to do to be as strong as you can, and then take on that next thing without all that additional stress and fear. So that's about it. I'm gonna go in, like I said, next Friday for my last treatment, so we'll see how that goes. I'm real excited to be done with it and then move on to the next step. So I may get back with you guys before my treatment. We'll see. But if I don't, it's because I'm dealing with my loss, and you know, I'm going to be dealing with that, so I may not. But anyways, thanks so much for hanging out with me and dealing with my bad day. I guess this is a bad day, but overall, I mean, I'm going to say that it isn't really a bad day. I've had some really good outcomes with, you know, my last treatment. I'm feeling really positive about my last one. So I guess it's sweet and sour today. But anyways, I hope you like this video. Click like if you do, and please subscribe to my channel. It means a lot to me. It's like you're sending me love. So if you're going through this yourself, I'm really sorry if I've made you panic or worry. Just do everything you can to keep your head in a positive place. And if you find that, you know, you're listening to other people and those experiences that they're having are scary, and they're making you worry about what you're going through, shut it off. You know, don't subject yourself to more than you're already going through, okay? Because that's not really productive, okay? And I'm sending you all love. My friends and family, I love you very much. My followers, I'm sending love to you guys. Thank you. And I will see you next time. Take it easy. Bye-bye.